everybody. All right, so we're going to take it back to the old school days of paper charting in the dental office. And I really like this because it really gives you a good feel for how everything should look and feel in the mouth. And it makes it actually easier to chart online, I think, or on the computers. So what are you going to need to get started with this assignment? You're going to need to print off several of your charting forms. We used these when I was in school. And you're going to need a blue, red, and black pencil. Hopefully you can find some with erasers, as well as fine tip markers in red, dark blue, and black as well. The pencils will be for the temporary version that you will write as you are debating on what to put in the chart. After you and the dentist have agreed on what should go on the chart, you can enter them into the chart in pen and go by your template that you use pencils for. So just keep that in mind. Okay, so when do we chart? We chart at every recall appointment. We do a new charting form for every patient. When they come in, we rechart. They could have been in Hawaii and broken a tooth and gotten a new crown. They could have had a tooth fall out due to trauma. Anything can happen. So we always want to start fresh and look at the mouth. When is it okay to write no changes at the bottom and do just kind of ask them and look around real quick, and if there are no changes, just mark no changes? That's going to be on a reappointment and a re-eval appointment as well. So reevaluations and reappointments, you can write no changes at the bottom, and otherwise you need to rechart every time, okay? You're always going to put the patient's name up there, the date, and your name as being the person that charted and entered everything into the patient's chart. Now, something you need to realize is that this is a legal document. This is part of the patient's record forever. We don't ever go in and erase or change anything once we enter it into the actual chart. That's why it's good to have these pencils so that you can erase and do what you want to do and be happy with your decisions before you enter them in ink into the patient's chart. Remember, all missing teeth go in as blue, and all pathology and abnormal things go in as red when you use your charting, okay? And so this is something that we have to get it correct. You need to know the correct symbols, and you need to make sure it is updated constantly so that whoever looks in the chart will know this is the most current version of the dental charting, all right? On this chart, you see the permanent teeth on top and bottom, and in the middle, you see the primary dentition. And so we'll talk about those throughout the video, how to chart on these dentitions. Okay, so let's get into actual charting symbols and colors for each individual thing that we might find in the patient's mouth. The first one we're going to look at is a missing tooth. The missing tooth could be, this is going to be represented by a blue X, like right here. This is one tooth that is missing. It's not unerupted, it is missing. So missing means we have an X, and that is always in blue. If you have more than one and they're together, you can do a big X. And if you have the whole bottom arch where there's like a full denture, you can do one giant X on the bottom to save yourself some time, okay? Same thing on the top. If you have 3 missing teeth here, you can do a big X over those in blue, all right? So that's a single tooth, multiple teeth, and a full denture, or the entire arch. All right, so what about a partially erupted tooth? Well, a partially erupted tooth is going to be outlined in blue, and then you're going to kind of do a swish mark here, a swish mark here, and a swish mark here. 3 lines to kind of show you where the gingiva or gums are protruding over the tooth. They're covering up the backside of that tooth there. We see that the front is out there open, and that the 3 little lines behind it show us that it is covered up by gum tissue. It's either partially erupted or impacted or something like that's going on, okay? So that's for a partially erupted tooth. All right. The next thing is an amalgam restoration, and we have several on here. you always want to draw it just like you see it. So if you've got like a dot here and a dot here and a larger part that rolls over in your proximal, you'd want to put each one of those. You don't just want to color in the whole top if it's an occlusal. You actually want to color it to look just like the filling amalgam in the patient's mouth. So there's one on number 2, or excuse me, number 3 right there. And then over here on number 14, it looks like we have a buccal pit and amalgam, and we have an MOD on 14. We have a DO on 15. And you're probably wondering what that red is right there. Well, you know that means something's wrong or abnormal or pathosis is there. We'll talk about that in a minute. If you see the little dot that's open here, we'll talk about that in a minute as well. That's not an amalgam. That looks different. It is different, okay? So right now we're talking about amalgams. They are coated in blue, and you mark them on the surfaces that the amalgam is actually on, and you want to make sure you do a detailed job that looks just like the filling does in the mouth, okay? Now we'll talk about composites. Composites are also in blue, but they are not filled in. So you can see here on number 15, we have a composite buccal pit right there, okay? And then I'll do a composite right here on number 5 on the occlusal. And we know that that is a composite because it is open in the middle. It is white. So that shows us that we have a composite filling there, okay? Let's see here. And then sometimes you will see things that look like composites in the mouth, but they are actually very different. They are sealants. Remember I told you in clinic that a sealant will be white as milk in the mouth, okay? And a good dentist does not want a filling to be very white. They want it to be the color of the patient's teeth. They don't want the filling to stick out. If you have a composite filling, the whole idea is to match it close to the teeth so that you don't even know it's there. So if you see something that's in the tooth and it's really white and smooth in the grooves, you have a sealant. So this looks like a composite would be charted with the circle with a hole in the middle. However, you see the S below, you can either write a S or write the word sealant below. And that will indicate this is not a composite, but rather a sealant. And this will need to be done on all teeth with sealants. Hopefully they're only on the occlusal surface, okay? If they're done correctly. I'm going to show you how to chart crowns now. Lots of options for crowns. They're made out of a lot of different things. And some of those include gold. Porcelain just by itself with no metal underneath, and then you have a porcelain baked on top of metal, which is a porcelain fused to metal, and stainless steel. So how do you know how to mark these crowns? Well, we'll start with gold. Gold, you're not going to see a lot of gold, first of all, unless you have patients that are in their 50s. Gold is expensive, but it's the very best of the best for back teeth, especially crowns. Where you can't see the flashy gold. It wears really well, and people just don't have problems with it. They have it for a long time and don't have problems. So how do you mark it in the mouth for charting? Well, you outline every crown in blue all the way around to show that where the restoration fits. And just like your wedding band sits on your finger across like that, just like a ring, you will go horizontal with your marks for a gold crown. Okay, so anytime you see a crown with rings around it like that, horizontal rings, you know you have a gold crown. Over here we have another crown that's been outlined in blue, and we have diagonal lines, and diagonal lines are always going to be on a crown. They're going to be porcelain, which is all white. Okay, so you can see we have a porcelain crown here, porcelain crown here, a gold crown there, according to how the lines fall. Now look over here. Here's a challenge. Check this out. This is a crown, and as you can see, they're a diagonal, which means this is a porcelain crown, but look at the base right here. The base has got lines going across, and that means that this is porcelain baked on top of metal. So the bottom is metal, so the lines will go across straight. Like that. and then diagonal marks across the chewing surface of the crown or the top of the crown, okay? So you have lines going in 2 different directions because that is porcelain baked on top of a metal base or a porcelain fused to metal crown, right? Over here we have stainless steel. Stainless steel is the cheapest version of all the crowns. It's really meant to be temporary. That's why we see it a lot in children because their teeth are going to fall out soon anyway. So why invest in a fancy, expensive crown if the tooth is going to fall out in a year or two? These are kind of like the acrylic tips when you go get your nails done. They just dig them out of a box and they're universal sizes. They find the one that fits the best for your tooth. And then they put it on top. They're already pre-made in a box. They clamp it down to the tooth, and hopefully your tooth will not be wearing this for very long. It'll either fall out from being a kid and naturally exfoliating, or it will be replaced soon by a real crown. But you color it all in with blue, and you know, it's something that it's just a cheap way to have a quick crown fast, okay? So that's a stainless steel crown colored in blue. Okay, let's talk about root canals now. On number 4, you can see that it's got a line down the root, and that's to indicate that this tooth has been treated by an endodontist. A man-made substance has been placed into the root called gutta percha, and now that root is non-vital. Now, the patient can tell you they've had these, but we do need to see x-rays before we mark it on the chart. So we need to see the x-ray gutta percha down the middle parts of the root before we mark it on the tooth, like on number 4 with a blue line. Number 5 has had an apoectomy. That means that this is a problem child root on number 5. And the doctor thought it would be best to go through the gums and actually cut off the bottom of the root or the apex to open it up and hopefully help with infection and problems that the tooth is having. And that is indicated with a blue open triangle at the end of the root, okay? Honestly, don't see these very often. It's not very common to see an apoectomy. And honestly, the patient's probably just going to think they had a root canal. They're not even going to, a lot of times, realize that was an additional step that was taken during the root canal or the treatment. And so anyway, that's an apoectomy. For bridges that are fixed, we have something that looks like this. We have number 20 through 18. That is a 3-unit bridge. Now this patient must have wanted to reuse their gold crown on number 20. Usually all the crowns match in color. But as you can see, number 20 is a gold crown because of the horizontal bands. And number 18 is a porcelain crown, and they are holding down the fort for number 19. 19 has an X through the root in blue because that tooth is gone, but we still have a crown there that is attached to the other 2 teeth. So this crown here is attached and held in place by these 2. The teeth that hold down the fort on a bridge and the crowns that cover natural anatomy, like this and this with roots, are the abutments. And the pontic is going to be the portion of the bridge which replaces the missing tooth. So here's our pontic right here, okay? And so again, the pontic will have an X through the root, and the lines going across that X will indicate how many units are involved in this bridge. So we have 1, 2, 3 unit bridge. And you have usually a minimum of a 3-unit bridge, obviously. Sometimes you'll have a 4 or 5-unit bridge, but you know, the bigger the bridge gets, the harder it is to keep it there long term. So you'll see a lot of 3-unit bridges in your career, okay? This is how you mark those. Okay, I want to show you an inlay and an onlay charting symbol. Inlays, the way I like to think of this, if you were laying down on the ground and you had your knees propped up, if a blanket draped over your stomach, that's kind of how an inlay is. It drapes on the inside of the tooth and the cracks and grooves, and it doesn't roll up to the cusp. An onlay is going to be like a blanket that's draped over your knees and down to your stomach. It goes over the cusp, it touches the cusp and goes over, and so that's an onlay. So right here we have a gold inlay, and the reason we know that's a gold inlay, it goes to the inside of the cusp and the bars go across like a gold ring, and that shows us it is made of gold. If it were to be an onlay, it would roll over to the sides And if it were porcelain, they would be a diagonal, but these are gold, so they go horizontally. So that's how you would mark an inlay or an onlay. You mark them in the chart just as you see them in the. All right, so we're going back to this diagram that we started with. You know, we talked about missing teeth and how to mark those. Well, if you'll look up here on the top arch, you'll see a long bracket that goes across the tops of the teeth. And you'll see little lines that are leaning down and touching the roots of certain teeth, okay? And what they're doing is, these are clasps, these are little hooks that actually hold the partial denture down around the teeth that are remaining in the mouth. So you want to make sure that you have a line coming down. Let me show you here. Each tooth with a line coming down is where you have a hook or a clasp that will connect around these teeth. Wherever you have a line, that is just acrylic and fake teeth filling in the gaps on the denture. And then you have some clasp here, and these teeth have not been marked out, so they are still present. Another clasp here, and a clasp here, and the partial goes all the way to the back. So that's why the line goes all the way across. So that's how you would mark a partial denture, by the line, the missing teeth, and where the clasp attaches to the teeth that remain. Okay, a denture is nice, quick, and easy. If all the teeth are missing on that arch, you do a huge X in blue, like here, and then you can write full denture or denture to the side, but it's assumed if you have the big X that there are no teeth remaining and that they do have a denture. That thing's pretty cool. It's called a space maintainer, and that's exactly what this piece of metal does. It is a little ring that fits around the tooth. It's got a little bar that pushes against this other tooth. When there's a space here, you can see this tooth has come out, it's been knocked out or fallen out, or decayed and been extracted. We don't want this tooth and this tooth to grow together and close up this space so that when their tooth comes through, it's crowded and it ends up coming out in the wrong place. So we literally want to maintain the space. And what we do is we have a device, it's metal, it's got the little bar that comes out, and it will push against this tooth and maintain that space for the tooth that will be erupting soon to come back through with no problems. And this is how we chart that. We have the space maintainer drawn around the molar in the back. We do the X across the place, the tooth that has been removed or lost. And then we do our little bar coming down and back around to the circle to show that there's no tooth here, but that there is a space maintainer holding that spot for tooth B, which we know will be a premolar ultimately, okay? It'll be number 5. So what if you have a patient that comes in and they have a retainer on the linguals of their lower anteriors where they've had braces in the past and now they have a permanent retainer? You go from where it starts to where it ends. You draw cement on the back in blue where they're attached, and then you draw your line across the teeth showing that those teeth have been have a retainer that's been cemented down and it does not come out. Also, if they have full ortho, you can, instead of putting all the brackets on all the teeth, you can just write full ortho or partial ortho or braces on the charting. So that we know that this patient has orthodontic appliances in the mouth. Okay, so here is charting for an implant. Remember, an implant is a tooth that is gone and it has been replaced with a man-made body post of the implant, an abutment, and a new crown, okay? So we're going to put an X through that root to show that tooth is gone. You're going to see that there's a crown there. And so what we're going to do is we're going to mark what kind of crown it is. In this case, this is an all porcelain crown on top of that body post and abutment. And underneath, we're actually going to write the word implant. Some places I have worked at put the letter I. But go ahead and write implant so that it's easy to determine that that is a implant. And when you're cleaning teeth, that makes it easy to know that you need to grab special instruments to clean around that implant. Okay. So let's talk about an unerupted tooth. An unerupted tooth is going to have a circle all the way around it. That's just like gum. And this is going to be in red from here on out. We're talking about things that are pathosis or problems. So this is going to be a red circle all the way around the tooth, only in permanent teeth. Okay, so in a child's mouth, that's not abnormal. So we don't circle them in red because we're not worried about that. That's the normal thing. But in an adult mouth, their teeth should be, at certain ages, erupted through. So if a tooth doesn't come through when it's supposed to, then we say, hey, something's up. We need to mark it and keep an eye on it, take an x-ray, go to an oral surgeon, whatever. So this is only going to be seen in a permanent dentition, okay? And we also would need an x-ray to confirm this. And then for caries, if we have a cavity, like on number 2, it's an open circle in red. So you can see here that the red area, the occlusal's got some problems on number 2. We have got some interproximal decay according to x-rays and the dentist on 12 and 13. Okay. And we want to mark them and leave them open. And then let's look over here at this filling. So this filling has a problem around the edge of this metal amalgam filling. It's leaking and it looks like it's either chipped or there's a cavity starting there. So that shows us that, yeah, there's a filling here, but something's going on around that filling, and we're going to need to either take out the filling and replace it or do a crown. Something's going on. So that's showing us there's a problem there, a defective restoration. Let's look at rotated teeth. Here we see that these teeth are, even though they have their permanent retainer in, the teeth are still a little bit rotated down here. And so we are putting arrows in the direction that the teeth are rotated in. And of course, that's not something that's we consider, normal occlusion. So we're going to mark them in red as well. All right. Okay, let's talk about mixed dentition and primary dentition. So right here we have Mary Kate Young. You can see Mary Kate is very young. She has all of her baby teeth. She has no adult teeth, and that's how you would chart that, okay? That she, nothing is erupted yet. That would be simple. You could add some decay and things like that if she had issues with her teeth or sealants. Then we have Marty Smarty. And you can see Marty Smarty's about 8 years old. He's got his 6-year-old molars. He's got his central and lateral incisors. And he's already got some sticky spots on his molars. He's got a stainless steel crown there on T. And he's missing all of his front baby teeth, anterior baby teeth. And over here you can see a space maintainer where he's had a tooth pulled, probably from cavity. And that little space maintainer there is holding the spot for his premolar, which will come in soon, okay? Or relatively soon. So that is a mixed dentition where you use the top and the bottom, and then just a primary charting up there where there's not anything involved yet with permanent teeth other than the fact that they're still under the gums. Look at food impaction. So those can cause a lot of problems for people. A lot of people that get braces, they have the bands on their back teeth that kind of hold everything down, and when they get their braces off, they have like a permanent little ditched out area where that metal band was pushed so far down. I know that my husband, when he got his braces off, his teeth were nice and straight. But every time he ate a meal right in here, he would always have a lot of food packing down in there. He would brush and floss, but he still ended up with a giant cavity almost going down the root where it just trapped food constantly. So it's important that we mark those, and obviously that's not a good thing, so we want to put it in red. So anytime you have food impaction, problems where food is getting stuck and it's hard for the patient to clean, you want to mark it with a red arrow in the area where the food is impacting, okay? And then right next to it, the little red triangle is going to be an overhanging margin. So if you look at number 3, you'll see that filling there's like an extra chunk of amalgam hanging off the tooth that's causing a pocket. It's causing bone loss and irritation and food. to get stuck. It's breaking off floss. So we definitely want to mark that as well with a filled in red triangle over any areas that have an overhanging piece of cement or overhanging metal from like a filling or even some composite material. Okay, very important to mark that and hopefully get it taken care of and removed soon. A diastema, remember we don't mark diastemas in children, but a diastema, something you need to know about that, it's anywhere there's a space between teeth, so you're going to use your red pencil to mark your diastema there, okay, showing there's a space. And I know this is a child's mouth, but I just wanted to show you that anytime there is actually a tooth extracted, you want to widen the diastema and actually put it on each side of the teeth that remain. So, you know, you've got your regular diastema where there's just some spacing, and then you've got your extraction diastemas on each side of the X. And again, children, they do have diastemas, but we do not mark them because they have them almost between every tooth so that they'll have room for their permanent teeth. So that's not an abnormality in a child, so we don't mark it. Here we have a drifted tooth with K and L, and you would just take your arrow and put it in towards the direction where the tooth is drifting. So just, you know, that shows the movement of the tooth, all right? Just like that, a little side arrow in red. For an abscess, go up here to number 2. You do an open circle on the root itself that is abscess. So if there's a multiple, usually there's only one root involved. I guess there could be several, but if you can tell what root is showing the abscess, you mark that particular root with the circle at the end of the root in red. For a fractured tooth, like on number 7, you do a jagged edge showing a fracture mark wherever the fracture has occurred, okay? And you don't have to outline the whole thing. You just would do a jagged line there, okay, to indicate the fracture. For gingival clefting and recession, you can see here that each one of these teeth has a lot of recession. Okay, and so this is something I think on the computer you would do in your perio charting, but in paper charting we show it with our red, and you try to draw it just as you see it in the mouth, okay? Well, this concludes our charting on paper tutorial, and I hope it helps you. You know, you can reach out to us if you have any questions, and we'll help you any way we can. But have fun with this, and even if you're not an artist, you can still make a beautiful charting to be proud of. So thank you, and get to it.